So you just heard about the new daily version from Wegovy, a move that could make these medications more accessible and easier to use. For a lot of folks, the big question goes beyond convenience and cost, though. What does it mean for your long-term health? To help us break it all down is Dr. Dyan Hes, the Chief Medical Officer of eMed. She joins us now live. Dr. Hes, you work with patients who take GLP-1 therapies. What exactly do they do in the body that leads to weight loss, and what's responsible use of the medication?
So responsible use is being supervised by a physician. You don't want to do any kind of program where they just send you the medicine in the mail and there's no oversight. At eMed, we have monthly check-ins with doctors, and how the medicines work is that the medicine makes you feel full. So the GLP-1 stimulates your brain to feel full. It also stimulates your pancreas to secrete more insulin if your glucose is high. It slows digestion, so you feel fuller for longer. So your stomach is actually full with the food you might have eaten in the morning, still at 8 o'clock at night.
Wow. Does that have to do with the term food noise? What do we mean by that?
So food noise actually is working on the receptors in your brain. So it actually decreases the desire for those foods. So for people, it's almost like turning off the radio. Like you don't hear that food noise, that dopamine surge for cravings, things like that.
Dr. Hess, why are we seeing such a surge in people taking GLP-1s across different ages, not just for diabetes any longer?
Because they work. So GLP-1s, if you're overweight with a risk factor or if you're obese, these medicines are life-changing. We know that obesity is caused by multi-factors. So it could be genetics, lifestyle. You could have medications that cause you to be obese. So these medications are giving people a new chance on life who know that they've done the work, they've changed their diet, they've exercised, and they still can't take the weight off. And then for some people who, mothers who gained weight after their pregnancy and they can't lose it. These are changing the lives of people, and I think the pills are going to change the lives for men as well.
So how do people experience the best outcomes, doctor, for long-term weight loss?
So the best outcome, somebody has to exercise. It should include some weight training or resistance training because you don't want to lose muscle mass because you're losing weight, but you're also losing muscle at the same time. A smaller amount of muscle, but you can lose muscle. So you want to be active. You want to lift weights. You want to do resistance training. You want to go on a hike with your family. You want to eat enough protein, but about 1 to 1.5 grams of protein per kilo per day. Your doctor can help you calculate that. You want to drink enough water because these medicines do have side effects. You can get constipated. You want to make sure you eat small amounts, and you don't want to eat the wrong foods, because what I always remind my patients of is that yes, you're less hungry, but you have to eat the right foods. If you eat French fries or pizza and that oil and that fat is sitting in your stomach for hours on end, that's when you get the side effects. That's why we want to have really strict, I would say, supervision, oversight, and a behavioral program with the drug.
Wow. The change and the difference that it's made in so many lives already has just been dramatic. Dr. Hess, we can't thank you enough for sharing your wisdom and expertise with us. We appreciate it.
Thank you.